Okay, we're connected. You may begin.
Okay. Good morning. I'm Dave Anderson, and I serve as Chair for the Kansas Behavioral Sciences Regulatory Board. Today is Monday, July 20th, 2026. I ask the members of the board to respond to a roll call to signify their presence at this open meeting that is being conducted in hybrid form, with some individuals remote by conference call or other electronic medium, and some individuals present at the board's office. Denise Seisman.
Present.
Jill Flessing.
Present.
Linda Heitzman Powell.
Present.
Donna Honer Queel.
I do not see Donna.
Okay. Mary Jones.
Present.
Jim Kilmartin.
And I don't see Jim. I think he was traveling.
Richard Nobles.
Present.
Andrea Perdomo Morales.
Present.
Cynthia Schindel.
Present.
Laura Shaughnessy.
Present.
David Stevens.
Here.
I note the following staff members are also present: David Fye.
Here.
Leslie Allen.
Here.
Cindy Darple. Thought I saw her name.
I see her on there.
All right. Tim Resner, serving as legal counsel for the board, is also present.
Present.
Next, David Fye will read a message concerning this meeting being held remotely.
Thank you, Dave. This is David Fye, Executive Director for the Kansas Behavioral Sciences Regulatory Board. Public comment allows the public to address the board about its concerns, but the Kansas Open Meeting Act, or the KOMA, does not require the board to provide public comment or answer questions from individuals. Individuals requesting to provide public comment to contact the Executive Director prior to the meeting by sending an email to david.fye@ks.gov. Time has been allowed for several presenters today to discuss the topics on the agenda. Because we are conducting this public meeting in hybrid form, I state for the record the following information. Access to this meeting is being conducted in person and also by medium of interactive communication that allows members of the public without cost to attend the meeting through either in-person attendance, use of the conference call, or by viewing the board's YouTube channel. While the meeting is conducted in hybrid form, the requirements of the KOMA are not suspended. As such, we will be conducting this meeting pursuant to the KOMA. On May 14th, 2026, we sent notice of the board meeting to all individuals who had requested such notice. The notice is also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other media material have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel, allowing members of the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, members may call or may send an email to the BSRB office at bsrb@ks.gov. A recording of this meeting. If there are two individuals who are present on the conference call line, I'll go ahead and ask those two individuals to introduce themselves. So if you are on the BSRB conference line, could you please go ahead and introduce yourself?
Hi everyone, my name is Erin Donahue and I'm here representing Acadia Healthcare. I'm a regional director with Acadia Healthcare, currently overseeing our Wichita CTC facility. Thank you so much for letting me be here today.
Thank you, Erin. And I noticed you just entered the waiting room, so you are now on the Zoom as well. If you want to go ahead and these select which one you prefer to use. So, and I remember there was one other. Thank you. And there was one other individual who was on the conference call line earlier. Could you go ahead and introduce yourself as well?
I'm the Executive Director at Fort Mental Health Center. I also serve currently as the Public Policy Chair for the Kansas Association of Addiction Professionals.
Okay. And are there any other attendees on the conference call line? Okay. If I hear anyone else connect and introduce themselves, I will let you know.
Thank you. All right, the meeting is now called to order and the board will begin its discussion of the first item on its agenda. I'd like to welcome all of our guests this morning. Appreciate your being here with us. First thing is approval of the agenda.
And Dave, I have one requested modification for the
Okay.
agenda. We have a special guest visitor this morning. We have a few guest visitors, but one contacted us from the Association of Social Work Boards. Her name is Susanna Sung. She is the Regulatory Services and Government Affairs Senior Coordinator for ASWB. And she just asked for a few minutes to provide some updates to the board, similar to what the National Association for Regulatory Boards for Psychology did at the last meeting. So if it's okay with you, I'd like to add her presentation or brief announcements to the board before we begin this section that talks about the student temporary addiction counselor license.
Okay. Any other additions or modifications to the agenda? If not, I'd accept a motion.
I'll move to approve as amended.
Second. We have a motion and a second. Any further discussion? Hearing none, all in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Thank you. That moves us to a discussion on the student temporary license addiction counselors and potential changes.
And actually, Dave, with that modification, do you mind if Ms. Sung gives us some information?
Okay, go ahead.
Okay. Well, Susanna Sung, thank you for joining us today from ASWB. You had reached out to me to ask if you could provide some updates to the board, and so I'll turn it over to you if you could share some information for the board members.
Thank you so much, David, and thank you so much to all of you on the board for having me this morning. I am with ASWB, and we are launching our member engagement program, whereupon we are trying to prioritize attending board meetings so that we can better understand some of the issues and concerns that you have in your work so that we can best support you in your work. I'm here to provide some updates that about ASWB and the exam in our meetings for you. I'm always happy to be available to take questions from you and or take any issues that you may have back to ASWB so that we can get some answers or support for you. The quick announcements that I have for this month is just the reminder that we have the new exam format for the social work exams that launch on August 3rd. The new exams will feature fewer questions, down to 110 questions, whereas in the past they were at 150, and down from 20 pretest items to 12. And we're also increasing the proportion of 3 option items from the 4 options on those multiple choice questions. And we're including a higher proportion of questions that rely on the application of professional knowledge. We are keeping the same 4-hour time limit. The fees have not changed. The scoring has not changed. The registration process has not changed either. And all of those detailed informations, as well as updated online practice exams, are on the website as well. Some upcoming meetings that you may find helpful is that we have our next new board member training October 1st to the 3rd in Reston, Virginia. We have the annual meeting of the Delegate Assembly November 6th to the 7th in Salt Lake City, Utah, and the 2027 education meeting has been scheduled for April 16th to the 17th in Montreal, and you can register for all of those on our website and through engage.aswb.org. And those are all of the updates that I have. I'm happy to take any questions or concerns or issues that you may have.
Thank you very much. Are there any questions from members of the board? Okay, I don't see any. Suzanne, thank you.
All right, you're welcome. And David has my email address, so feel free to reach out at any point in time if you have any questions or concerns you'd like to relay to me, and we can help. Thank you.
Thank you. Okay, now we'll move on to, also want to acknowledge Commissioner Drew Adkins has joined us from KDADS. Hi, Drew.
Good morning. Happy to be here. Thanks for having me.
We'll now move to our discussion on student temporary license addiction counselors and potential changes.
And I'll start this conversation with just some framing of this discussion and how we got to the board agenda. So basically, during the 2026 legislative session, there was a bill that was introduced by representatives of Acadia Healthcare that would create an apprentice addiction counselor under the BSRB. As you may recall, this was brought to the attention of the BSRB. We were made aware of the bill and it was scheduled for a hearing, but this was something that representatives of Acadia had worked on with representatives from KDADS, the Department for Aging and Disability Services, with a different thought process in mind of perhaps a certificate. But ultimately it was introduced as a bill that would create licensure. We reached out to representatives of Acadia at that time. There were several meetings that were scheduled with different stakeholders. Ultimately, there was not an agreement between everyone involved in terms of what would go into a bill. And admittedly, I think the stakeholders from Acadia mentioned at that time too, that the bill that was drafted was not entirely what they had in mind as well. And so what we decided to do was it was resolved by the group of stakeholders to come together this summer and continue to meet with a goal of reaching a consensus position by the end of July. And so some of the complexities and the different things that were highlighted by the stakeholders talked about the interest that Acadia had in wanting to address their workforce at their facility. Also looking at what is required under licensure and law and some of those standards. Also looking at reimbursement and how some of these things are for a good solution to work, there's a lot of different things that are in play. And so we resolved to continue to work on these topics this summer. Part of these meetings were held by the BSRB offered to use our advisory committees for these stakeholder conversations and discussions. And so we had a meeting of the Addiction Counseling Advisory Committee that took place on June 15th, 2026. At that time, Acadia had put forth an alternate proposal from what they was originally introduced in the bill during the 2026 legislative session. So it would not be an apprentice addiction counselor license. What was put forward as an alternate proposal were some proposed changes to the student temporary license under the BSRB. There were 3 changes to the statute that were proposed by members of Acadia. One, there's currently a requirement now that individuals that obtain a student temporary license would have to have a minimum age of 20 years old. So their proposal would be to eliminate that age requirement. 2, there's a current requirement of 60 credit hours and with an emphasis in addiction counseling or related field. And the proposed change would decrease that from 60 hours down to 18 hours. And then the bill also, or the proposed change to the statute would also list 5 different defined scope of practice actions for someone who had a student temporary license. And so these were taken to the advisory committee. Representatives of Acadia answered questions about these different items and spoke to the committee about a desire to have these put forward to address the workforce concerns. We also invited representatives from KDADS and also the Board of Nursing to talk about some different other paraprofessional staffing positions in the behavioral health field. Representatives from KDADS presented information on Kansas Certified Peer Mentors, Kansas Peer Support Specialist, Person-Centered Case Management, and Personal Care Services. And there was some other information that was provided, including some attendant care for behavioral health rehabilitative services, psychosocial rehabilitative staff, some other positions. And then Board of Nursing, their representatives talked to the committee about the program that is currently happening at the state hospitals with mental health technicians and how they are expanding that program in Wichita. We had a follow-up meeting in July in which representatives from the Kansas Association of Addiction Professionals talked to the advisory committee, and they expressed concern about the proposed changes and addressed the advisory committee. Ultimately, the authority of the behavioral sciences advisory committees are to make recommendations back to the board. And so it was the recommendation of the advisory committee to recommend to the board that the board not make any changes to the student temporary addiction counselor license. There are representatives today from Acadia who are interested in addressing the board about a solution to address their workforce needs. and the proposed solution that they had brought to the advisory committee. I understand there's representatives also from the Kansas Association of Addiction Professionals. Representatives from KDADS are also present as well. And so we would like to continue to work together and give you all as board members the opportunity to hear information on these topics. When an advisory committee recommendation is brought to the board, it is still the authority of the board, whether you want to go in the same direction as the recommendation from the advisory committee, if you would like to do something different. And so ultimately, it's the board of the BSRB, representatives from the different professions and members of the public that serve on the board that have authorities to make decisions in one way or another. Just to give you a little bit more information about the student temporary license in your packet of material for this meeting, you should see a copy of the statute KSA 65-6611. And that is the statute that deals with temporary licenses for the addiction counseling profession. Down to the highlighted section in item G, you have more detail in terms of the definitions and current requirements for the student temporary licenses. So feel free to look at that document. You also have a second document that looks very similar because it is a copy of the same statute, but the header of the second document says information provided by Travis Lowe. And that is the information that was provided by Mr. Lowe as a representative for Acadia when he spoke to the advisory committee. And the document with the header information provided by Travis Lowe on June 11th, 2026 includes some of the proposed changes to the rate of the statute, including the change to the age requirement, the change to the number of credit hour requirement, and then also the scope of practice that would be included in the statutes. And so I wanted to make sure that you have those documents. And then also the representative from the addiction professionals who spoke to the advisory committee provided a couple documents. So those have been included in your packet as well. And so those were put forward by Deb Stidham at the advisory committee. So I want to make sure you had all that information for you today. So with that framing, I'm happy to turn it over to Travis Lowe and Aaron Donahue. And they could speak to you more about their requested proposed change to the student temporary addiction counselor licenses. So Dave, if it's okay with you, I'll just go ahead and turn it over to Travis and Aaron, and they can address the board.
Absolutely.
Well, thank you, Dave. And my name is Travis Slow, as Dave mentioned. Appreciate the opportunity to share just a couple minutes of conversation. I'm Travis Slow from the Braden Heinerloh & Associates firm here today representing Acadia Healthcare. And Acadia Healthcare operates the Wichita Comprehensive Treatment Center, which serves more than 500 patients at any given time. My colleague Aaron will talk more about the experiences that we see at the clinic, but want to reiterate and appreciate Dave's flyover summary as well. From the beginning, we introduced a bill that was a workforce bill, and its purpose has never been to lower professional standards or diminish the importance of licensure. Rather, we believe it's about creating a responsible entry point for the next generation while providing supervision opportunities and protecting patients. This proposal grew out of, without exaggeration, years of conversations we've had with KDADS, I believe back almost 4 years, and to create an opportunity for folks who are not fully licensed to be able to contribute more meaningfully at the clinic beyond just answering phones. And our team, and Aaron can attest, we've reviewed programs in other states, and whether these people are called students or interns, in some cases unlicensed professionals, workers. We believe that there's an opportunity for Kansas. So after introducing the bill, we heard concerns from the BSRB. We heard concerns from the industry, from the stakeholders, just good conversations that take place through the policy process. And we talked to the legislators as well. And a House Health Committee Chair, Will Carpenter, and his Vice Chair, Ron Bryce, challenged the stakeholders to continue working to develop a compromise and gave us a specified date of July 31st. Really want to thank Dave for holding us to that. He's done a lot of work trying to keep this train on time, which has many parts. The proposal that we have offered to you today, we believe, reflects a compromise from what we originally had in mind. And rather than creating a new apprentice program, we are proposing targeted improvements to the existing program that the executive director mentioned, was located in KSA 656611, which is the student temporary license statute. We recommended just 3 changes, and that is modify the age requirement from 20 to removing the age requirement, actually, reducing the number of hours from 60 credits to 18, and adding a specified scope of services of what those students can do in the clinics. It's not a mandate, but they have that ability. Right now, it's just not documented at all. These recommendations, as we mentioned, were based on what our team has experienced working literally in other states nearby and across the union. And so we have listened to the concerns that this group offered back in your March meeting, or some of the feedback from the staff, which your staff has just been wonderful to work with, extremely responsive. We really appreciate that. And then we've had meetings amongst a large group of stakeholders. We've had offline meetings with other stakeholders. We brought this forward as we thought it was probably the most pragmatic way that we can accomplish our goals to get the next generation involved without what they perceive to be a high barrier to get into this workspace. And so we appreciate your opportunity to take a look at this as well. We appreciate the opportunity we had with the subcommittee. We admittingly didn't get a lot of feedback other than recommend no change. We don't see this as we see this as a conversation. We don't see this as we want 60 hours or we want it to be 18 tax title license. At the end of the day, if y'all think, hey, it should be 30, it should be 40, maybe include these 3 or 4 courses, we look at this as a conversation. And we do appreciate that, because we know that's how the policy process works. At the end of the day, and have the opportunity to sidebar with our team, we just want to reiterate just a couple points before I turn it over to Aaron. All these examples that we put forward, the amendments that we brought forward, are examples that we've seen in other states. So none of this is trailblazing policy, so to speak. From the feedback that we heard in the subcommittee, I was left with the impression, just my opinion, that Kansas appears to be somewhat of an outlier and the ability to get the next generation plugged in. We do believe, from our experience at the clinic, that we have a workforce need, and Eric can talk about those shortages. And from the applicants that the clinic has received from young people interested in getting into this field, who have some college experience but not the full level, it does seem like there's interest, but they're not able to get to the door. So with those 4 points, we do appreciate your time this morning. We know your time is very precious. And Aaron, I'll yield to you.
Wonderful. Thank you so much, Travis. Just want to confirm you can hear me okay? Okay, perfect. Thank you so much again for inviting us to join this call with you, and for the continued collaboration and just, cooperation amongst all of us. To echo what Travis mentioned, this is definitely a conversation. We really want to meet somewhere in the middle if that becomes a possibility. And our primary goal is to remove barriers to care and really expand access to care in Kansas. So as Travis mentioned, the current requirements for the student temp license, in our experience, have been limiting. Just to give you context for our Wichita CTC facility, over half of our initial applicants are immediately screened out because they don't meet the education requirements under the student temp license. Currently, it takes us about 5 months on average to recruit and fill our open counselor roles. And we are currently in such a shortage that we are at risk of going on another admission hold. We've previously been on an admission hold back in 2023, where we were not able to admit patients for almost 5 months due to workforce shortages. That, as you all know, is hugely a problem. We've still got a lot of opioid overdoses in the state of Kansas. We still have hundreds of individuals that are reaching out and seeking support every single day. So we are at risk of going on another admission hold at our facility, specifically because we have struggled with onboarding and recruiting for counselors. If workforce shortages continue to be a struggle, patient care will obviously continue to struggle as well. And while I absolutely understand the board's stance that we want all of our clinicians to be competent and qualified individuals in order to drive positive patient outcomes, The reality is that we can't even have patient outcomes altogether if patients aren't being admitted due to workforce shortages. So we believe what we are suggesting is a responsible pathway to full licensure that still ensures appropriate oversight and accountability measures while providing clinicians with real life practical opportunities to practice their skills under supervision. And as Travis mentioned, this would not be unique to Kansas if we were to expand the student temp license. Throughout our research, and we work in multiple states within Acadia, we've noted that other states who have a similar structure to a modified student temp license would be Georgia, that requires 180 training hours to become an intern, Iowa, that requires 150 training hours, Idaho, that requires 270 training hours, North Carolina, that's 290 to 300 training hours, Pennsylvania, 270 training hours, South Dakota, 270 training hours, and West Virginia, also 270 training hours to become either a qualified addiction professional or an intern status. So we've really seen the states with models for more entryway candidates to be very successful because it not only allows the clinician to practice their skills in tandem with their education, but it also allows these clinicians to determine if this is the appropriate field for them as well. So we really see this as a win-win for both the clinician side and the patient side, really wanting to expand the workforce and ultimately just treat more Kansans in need of services. So thank you again for the opportunity to speak here with you today, and we're very interested in collaborating and coming to a solution that works for everyone. So thank you so much.
Thank you, Aaron. Patrick?
Hi, I'm Patrick Fields. I'm the president and chairperson for the Kansas Association of Addiction Professionals. Thank you for having us here today. And listening to us and learning this talk with everybody. It's well concerned. This, from what we understand, the advisory committee is unanimously opposed to this already. At the same time, I just want to review that we have some concerns. Primarily, without question, individuals seeking alcohol and drug treatment services are certainly presented with complex issues. We're concerned about that. What they're proposing, though, we're concerned about reducing the number of hours required to obtain a temporary license. We think this can negatively impact quality of care. So as a result, the Kansas Association of Addiction Professionals does not believe that any further reduction in the educational requirements are necessary at this time. We actually question whether there is a workforce shortage, but that's another issue. Looking at what's proposed here, reviewing their scope of practice and the things they're asking for, we're concerned about removing an age requirement. I think 20 is fairly young as well right now. Maybe even a 17-year-old serving, looking at their scope of practice, they can be a primary counselor for a caseload. Even 20 is very young for that. The minimum number of hours, in addition, the specific course work, be included within 60 hours credit. From what we understand, that this latest proposal, they want a minimum of 18 credit hours, although they don't have any specific courses of what an addiction counselor needs to study or anything like that. I don't know about you guys, but when I had my first semester in college, I had 18 credit hours that first semester. I was kind of pushing it, but they were like English and math and biology, very basic courses, nothing along the lines before we would even expect an intern. And we have used interns traditionally throughout the process for these kind of roles. Even then, those interns were not the primary counselor in these situations. So we're concerned about that. Limited number of hours, the scope of practice is concerned. Again, serving as a under direct care service, primary counselor for the assigned caseload. Somebody 17 years old who do that. I don't know if that's a good idea. I don't know how much experience they have. Conducting case management activities and making referrals to appropriate resources, participating in treatment planning, care conferences, discharge planning. These are people, it sounds like they're proposing basically somebody has very little experience or education to do these services that, quite frankly, we believe someone with more experience and education should have in order to do these things. Even advocating for clients in treatment decisions, what do they know? What is their experience? We really view this as kind of watering down the standards. We view this, we know Acadia is a national company. They're based out of Franklin, Tennessee. They're on the stock market. You can see they are a for-profit healthcare company. You can also see they have a significant history of safety violations and lawsuits in multiple states. And programs getting shut down for safety concerns. When we saw this first letter, we kind of thought it was a form letter sent to multiple states, and didn't even look at what Kansas actually had when this was first proposed. We're not sure what the true problem we're attempting to solve with this change is. Is it more financial, or is it really looking at quality care and helping patients? Steve Denny, our public policy chair, is here as well. I appreciate Steve, he's online. Steve, do you have any comments that you'd like to add?
Not a lot. Can you guys hear me okay?
Yes.
Yeah, I think it's important to reflect back on the history of licensure in Kansas. I think Deb provided a really good summary of how we've arrived where we are today, going back to the days when things were pretty wide open, and some of the issues and problems that we've encountered previously to where we're at today. I think it's a decent kind of in the middle place where people can still have access and pursue the addiction field if they choose to do so. But there's also standards and expectations that must be met. I mean, the things that Patrick said that I particularly connect with, I do have questions about pH removal. I struggle to see an 18-year-old coming straight into the field and practicing counseling, in my experience. I do think the hours conversation is something we can talk about. I think what coursework is taken and what level of oversight is provided to the types of courses that the person receives. I think there'd be some transcript management, some other things. Maybe the board's already prepared to do that, but I think that's important to consider. And I think ultimately the main thing is it's merits the public trust, right? We want to make sure that the people out there providing counseling under Kansas licensure are indeed doing that based on our definitions and standards. At the end of the day, we're providing high quality care in Kansas. And I appreciate the workforce shortage concern. We've screened out applicants that didn't meet educational requirements as well. The majority of those I've experienced those were individuals who probably weren't ready to practice in our field just because they hadn't had adequate training or experience. And I do think the student option is a nice option. We just want to make sure it meets the standards to protect the public, particularly and provides a framework that KDADs and other regulatory agencies can make sure that the agencies are providing high quality care as well. So that's all I have to say. Thank you for giving me the chance to speak.
Thank you, Steve. Steve Kearney, did you have anything you wanted to add?
I don't believe so, Mr. Anderson. Patrick and Steve Denny covered most all. I think it's, lowering the age. We have a lot of current enrollment things going on between high school and post-secondary right now. And literally 17-year-olds are rolling out of high school with certificates or with, close to the hours that we require here, and that it's a kind of a public safety issue in my eyes. In that respect, that no experience, no training, maybe no particular course. In specific fields. Yeah, thank you.
Patrick, was there anything else?
Yeah, I would just say I appreciate Aaron's concern about half the applicants not meeting requirements, but in this day and age with online, like Indeed and things like that, it's very common for us to maybe even have 70% of the people applying for positions not qualify and not have license. I think they're just shooting resumes out however they can, and we do see that as well, but it doesn't necessarily reflect that there's a shortage. It just means we have to screen them out. It makes it easy to screen them out. Oh, you don't qualify. If that makes sense, but I understand that can be a frustration when you're going through applicants, but that's a real thing, but it doesn't necessarily mean we're not able to find counselors. I work with Valley Hope Association as well. We have programs in Wichita, Mountain Ridge, Norden, Overland Park, and Atkinson, Kansas, and we've been able to staff our programs and not have these issues. So that's our experience. I don't think anybody in the Kansas Association of Addiction Professionals considered that. I may be wrong, but I think we were all concerned about this, and nobody seemed to think this had much weight. We're more concerned about watering down the standards, but everybody works very hard to get these things done. Thank you for taking the time to listen to us today.
Sure. Commissioner Atkins, would you like to weigh in on from KDAD's perspective?
I think, in general, from KDOT's perspective, we're taking a neutral stance on this. Doesn't necessarily seem like something that will weigh into the providers that we license. And so it's been encouraging. Some of the questions that I had purely from an informational standpoint, I think have been answered. And I appreciate David sending over the information, but I think at this point in time, we don't really have too much to comment on, just here to observe.
Very good. Thank you.
The only other comment I would make is in trying to gather all the stakeholders together, the Board of Nursing did have representatives who attended one of the advisory committee meetings and presented information on the mental health technician program. They actually have a board meeting today at the same time today too. So I don't believe they were able to attend, but I did want to recognize them because I appreciated them providing information. And we did our best based on the letter that had been provided Representative Carpenter to bring the stakeholders back together and have an opportunity to bring some more information to the group. So I just kind of wanted to recognize the Board of Nursing as well.
All right. Thank you all. The board will be taking up this issue later in our agenda during our new business.
Do we have an opportunity to ask questions now?
Sure, absolutely. I'm sorry. Go right ahead.
Oh, okay. Thank you for all this information, and it's helpful to hear some of these things over and over again. My question is for Aaron. You talk about the different states having training hours. Can they be converted to credit hours? Because that's what we're looking at in terms of this proposed legislation.
Thank you for that question, and I'll have to get back to you on that. What I am certain of is that a majority of those credits are addiction-specific courses. So to speak to, the requirement or the suggestion that maybe there should be a certain amount that are addiction-specific, that is certainly the case in a majority of these states, and I can provide additional follow-up on that as well.
But so at this point, we don't really have a sense of, for example, Georgia's 180 training hours. That would be equivalent to 18 credit hours. That's I guess my question.
Just documented training hours. So they're going to look at their education transcript. I'm not sure of the equivalency on the credit transfer, so I'll have to kind of look into that and get more information.
Okay. Also, Travis, you had mentioned that that you felt that Kansas was an outlier among states in terms of having similar type of licensure. Are there other states besides what Aaron had mentioned that have legislation that pertain to student licensure and reduced requirements?
Yes, ma'am. Thank you so much for the question. Short answer is absolutely. When we were discussing this bill and really our concepts originally, full disclosure, we originally engaged our conversations with KDADs and not BSRB because the models we were looking at, these individuals weren't licensed at all. And part of the reason why we didn't engage the BSRB until when we did, because in our view, or our understanding, even talking to the department, was they regulate the licensed people in the clinics. And if they weren't licensed, they wouldn't be under purview of the BSRB. That changed when the genesis of the legislation evolved to having more of a broader application to it. So they are licensed, and we weren't married to if they're licensed, registered, certified. We know that means that has lots of different meanings. We didn't ultimately offer to do, like, for example, the dental assistants as an example. They're not licensed or registered within the Kansas Dental Board like a dentist or dental hygienist is. So, we've seen legislative hearings. Hey, are there 10 dental assistants or 10,000? They don't know because they're not part of the system. But they're in there working right next to the clinic or right next to the patients. So knowing that we recognize that might not be ideal, we opted for a situation where there is a licensure component to it, albeit we're very open to what that looks like. And so that was a long-winded way of saying, yes, we have looked at other states in addition to what Aaron was saying. We looked at Louisiana, we've talked about Oklahoma, we've talked about what's going on in Utah, other states as well. And so ultimately, and sometimes, as I mentioned too, they actually use the word UPs. They call them unlicensed professionals. And so again, I just want to reiterate, we're very, very open to the conversation. That is what, we recognize Chairman Carpenter won't be over there, but Ron Bryce will. I mean, we take their charge very seriously, and we're happy to trade language and other examples. So I do appreciate the question.
Thanks. I just have one more.
Sure.
And this I'm just gonna throw out to whoever would like to answer this. So if I'm understanding this correctly, in 2023, we created the temporary addiction counselor licensure with 60 credit hours. That's what, maybe 3 years ago. Do you think we felt the full impact of that new licensure? With it being, we haven't had very many years of experience, and probably there are a lot of students that are in the process of getting the 60 credit hours.
So if it's okay with you, I'll share some information on a factual basis, and then if people want to share some subjective, some thoughts on that too. I went ahead and pulled the numbers because I thought this might come up as far as how many had been issued. This was one of several items put forward by the bill. The board offered or requested from the legislature back in 2023. When that was passed, it had an enactment date of July 1st of 2023. So basically, we've had this in place for about 3 years, and ultimately in fiscal year 2024, there were 34 student temporary licenses that were issued. In 2025, it was about 24 student temporary licenses issued, and last year in fiscal year 2026. There were about 32 student temporary licenses that were issued. So currently, I say it's about an average of about 30 per year. Currently, there's about 53 that are active. And I looked at the individuals who previously held them. The vast majority of individuals that previously held student temporary licenses either have a permanent license as an addiction counselor or a master's addiction counselor. I think there might have been one or two that went to a different type of license, like a social work license. And then there were a couple that was the only license they held. But the majority of individuals that have obtained these student licenses still have those licenses. And so there are 53 active right now.
And Denise, I would add that people who went to a different type of license, that's because we have a route for them to get a social work license and then become an addiction counselor.
Yeah.
So
they have a different kind of license already that's in behavioral health. And so I guess what I'm wondering is, so you have a subset of individuals who are maybe in college right now and getting these credit hours, and 60 credit hours is significant. So as they go through this, you might have current students who would apply for this type of license maybe in a year or 2 years, and it just seems like we haven't really had an opportunity to feel the impact of that yet. to know if there's a problem that we're trying to solve. But I don't know if anyone wants to add anything to that. If my assumption is maybe incorrect.
Sure.
You had listed all these states, and I have not reviewed all of them, obviously. Are these trainings, the requirements, are these for people getting a credential, a registration, or a license?
All of these are a credential or intern status.
Thank you.
I have a question added to your question. Who is providing the training in these states? What kinds of organizations? Do you know?
Just higher education. So to my knowledge, and again, I'll provide, further clarification on this, but this is just, this is hours towards training, and they review transcripts in order to determine that.
Okay.
There are also, some states have trainings that are not from a college or university. They're just addiction specific. And those are usually done in hours rather than credit hours or. So there are states that use that kind of training as well.
But this isn't even defined. It's just 18 hours.
Right.
Dave, this is Travis. If I could add a quick clarification. I think when I answered the question earlier, I might have referenced Utah, and I meant to say Nevada on that as well. And also, I do, forgive me, trying to tune in here remotely, and sometimes the microphone for the guest wasn't super clear. Did CAP go on record saying that they do not perceive a workforce shortage? Did I characterize that? Did I hear that correctly?
I don't know if I'm on record, but I did state that we're not seeing it. Yeah, that's me as, I won't say it's the CAP record, but me as a professional that works with a company with multiple locations, we're not seeing it.
I appreciate you clarifying that.
We can certainly ask our group though, try to get it in our next meeting. If you'd like us to see that.
Well, with respect, I would be very interested in that. We do have one clinic on here that's been on, holds. So yeah, I'd like to have marry those two facts together. Appreciate the conversation.
Dave, do you mind if I ask a question?
Go ahead.
Okay. And this may be for Aaron or for Travis. I know, traditionally some of the agencies or the stakeholders here have a specific lane per se. We're all trying to come together to help with the solution. So we're kind of getting more connected, which I think is a positive thing. In terms of helping Acadia with its workforce solutions, I know the BSRB, the agency's jurisdiction is primarily what are you able to do legally under the law. But another component to that is billable services, and under the state Medicaid plan, that's another important thing of what's reimbursable as well. Part of the reason I think we had some of the stakeholders present information on existing positions that may be able to get reimbursements at the advisory committee level was to try to kind of look in different directions. We have the proposal from Acadia on the change to the statute, but there's also some potential other things that could be helpful. I am curious, since the advisory committee meetings, and I know we just had the follow-up meeting recently, have you had the opportunity to kind of look at some of those paraprofessional positions to see if some of those could address at least part of the workforce need that you're experiencing right now?
Dave, is that to us specifically?
Yes, either you, Travis, or Aaron, either one. Since we had provided all that information, I know we're trying to approach this from a few different angles. And so I was curious if you've had enough chance to evaluate some of those positions, maybe Kate has shared information on, or the mental health technician, the board of nursing shared information on too.
Dave, I have a response, but Aaron, I don't know if you have anything you want to say, but certainly I have some thoughts.
Yeah, I would say, we definitely reviewed the technician. I think, one of our concerns, and you just spoke on it, David, is potential with billable opportunities. But of course, coming back to systemic barriers that are also a challenge for us, the mandated caseload ratios in Kansas kind of coincide with the workforce shortage, right? We've got the 50-to-1 mandated caseload ratio that was modified, which we were definitely grateful for, that patients that have been in treatment longer than 2 years then count as 0.5 of a patient. I know that was a flexibility that was rolled out that's really helped. But, if we're short for workforce and then we combine the mandated caseload ratio, those things together are like the perfect storm to, prevent if we've got a surplus, we've got an influx of patients that need support and we're in a workforce shortage, our hands are really just tied. That's when we have to go on an admission hold. And that is what we always want to prevent happening. So I would say as far as systemic barriers that have become a challenge, the mandated caseload has also been a very large challenge for us for our Wichita facility. And then I can pass it back over to Travis.
Yeah, Aaron, I appreciate that. I guess I don't have anything to add.
Okay.
One more time, Dave, I just want to keep thanking you and Leslie in particular for bringing lots of ideas forward. It's been a conversation and we do appreciate that.
Yeah, happy to help and want to be good partners in this all. I know one of the things in the modified scope of practice talked sort of about case management. And I know one of the positions under KDAS that they had talked about was the case management program and those individuals that are out there. So I wasn't sure if that might be something that could be helpful, maybe not a full solution for everything that you're working with right now, but that is an area that it seemed to match up. And I was kind of curious on your thoughts on that one.
And then David, this is Drew over at KDOTS. Really quickly, again, just purely informational. I think we talked about this at the advisory meeting too, but we're working to finalize our behavioral health technician program. We've got to do some final kind of just housekeeping items with Wichita State University, who's been helping us with that, getting the modules on Learn Worlds and some of those technical pieces. Anyways, I was going to say we could have our group come in and share more information about that here at the board or at another meeting as well. That's helpful. I know that piqued a lot of interest for folks, and I don't know that it would solve everything that everybody's talking about on this call, right? But it just may be something for general information for folks to have that KDADS has been working on. That might be something that our young folks that are interested in this line of work might find interesting too.
David, can I add something?
Go right in.
I'm Jill Flessing. I represent addictions counselors on the BSRB. Even though the Addiction Counselor Advisory Committee has made a formal recommendation to the board, I just want to emphasize that while I have great appreciation for workforce shortage, I understand that's a concern, a problem. I want to add that being an outlier, Kansas has been referred to as an outlier, isn't necessarily a bad thing. If the BSRB's mission, or we've been tasked with meriting the public trust, providing quality care by a higher standard of education, in my opinion, and it seems like my colleagues on the advisory committee, in their opinion, that is a positive. We are providing a higher quality of care to ensure the public trust in a very complex behavioral health care setting. And I just wanted to make sure to say that out loud. And I believe is why the advisory committee, one of the reasons the advisory committee made the recommendation they did.
Thank you. Are there any other questions from board members? Seeing none, unless anybody else has any last minute comments they'd like to make. All right, thank you all. We appreciate your coming today and sharing this information with us. As I mentioned before, the board will take this up later in its agenda today.
Linda raised her hand there for a second.
Thank you. I just wanted to know, I know we're going to discuss it later, but what are our next steps? Like, continued dialogue and then approach the legislators again? Approach KDADs and see if they're interested in having it be a certificate instead of a licensure, right? Looking at the scope of work and the required hours to function as a counselor. What are the next steps?
I guess from a procedural standpoint, when we met this spring with different stakeholders, there was agreement to continue to work together to attempt to come to a consensus solution by July 31st. So I think as a first starting point, I would like to make sure that the group provides a response back to Representative Carpenter by July 31st. So that is something we'll need to send back. In terms of you know, what the board could choose to decide later in the agenda, that's kind of you know, up for the board's discussion. The board is one stakeholder at the table, but we are here at a board meeting, so that is the call and the role of the board. But the board will have the opportunity potentially to request further changes or request something else. The next opportunity for the legislature to potentially make any change would be in the spring, but functionally for things to be brought forward to the legislature, sometimes things need to be submitted ahead of time. And so there's a few things on the table, but at least the starting point, I would think based on our conversation this spring with Representative Carpenter, we should send a message back by July 31st. So there needs to be some further conversation after this meeting with the different stakeholders.
Thank you.
All right. Thank you all. Board will now move on to the next item on its agenda, a review and approval of the minutes from our previous board meeting on May 11th, 2026. Thank you.
Thank you. Thank you.
Appreciate your time.
I'm going to step out, Mr. Chairman, but probably hang around for the deliberations. Okay.
Has everybody had an opportunity to review the minutes?
I just have one question.
Okay.
It's on page 2, item 7D. The third line down, it says discussions covered compost boards. Is compost right?
Probably not.
That should be composite boards. Thank you for catching that.
Good catch.
Thank you, Denise. Any other alterations or additions to the minutes? If not, I would accept a motion to accept the minutes as amended.
So moved.
I second. Oh.
Okay. We have a motion and a second. Any further discussion? Hearing none, all in favor of the motion, please say aye.
Aye.
Opposed, same sign. Motion carries. Thank you. We'll now move on to our executive director's report.
Thank you, Dave, and I will do my best to keep this brief because I know we have a lot of items on the agenda today. In your packet of material, you'll see 3 documents from me today, or at least 2, and then one from our representative from Kansas Fights Addiction Grant Review Board, Jason Hess is the board's appointee, and so one of the 3 documents for this is from Jason as far as updates. But in terms of my report, most of it is written there with some bullets. I do want to congratulate and recognize board members Richard Noble, Cynthia Schindel, and Jim Kilmartin for being reappointed to the BSRB board. So they are in their 2nd term on the board. It's a 4-year term that board members serve, and they can serve a second. So congratulations to Richard, Cynthia, and also Jim on their reappointments to the board. You see an update there in terms of the number of YouTube broadcasts and views. Currently it's 254 meetings broadcast or uploaded after, and over 13,400 views. So we are continuing to provide outreach to different educational programs, students, basically to help them understand the process to apply for licensure in a more user-friendly way. We also let them know about unprofessional conduct standards so they can get a good start once they become a licensed professional. Our next presentation is actually tonight at 7:30. So Leslie and I will be attending that remote meeting for the students. So definitely want to thank Leslie for her service after hours, but we thought it was valuable to talk to the students. So we'll be doing that. In terms of the budgetary update, a couple meetings ago, there was a request for some more information on the BSRB funds. And so we have one fund for the agency, it's the BSRB fee fund. You may recall a few years back, the board put in place some pretty aggressive decreases in some of the licensure fees. That was primarily the renewal fees. And since that point, the first few years, it was the pandemic, so there were some unusual savings in different categories. But since we have gotten back to normal, basically, we've seen about $100,000 decrease in the balance of the fee fund, or a little over, consistently every year. You can see the balance July 1st of 2023 was about 2 million. At the beginning of 2025 fiscal year, it was about 1.9. Beginning of 2026 it was about 1.8, and just recently, July 1st of 2026, it's about 1.7. So there were some other changes that took place over the years. We were able to bring in some additional staffing and absorb that cost without passing on the new fees to licensees. And so there were some structural changes as well. But our goal is to draw down the balance in the fee fund to about 1 year of expenditures, which would be about 1 million to 1.2 million. And then we'll have to have a conversation about how to stabilize things. In the meanwhile, there's a number of factors that are hard to estimate right now, with different multi-state compacts that are likely to go live over the next few years. So we can monitor that, but the rate of decrease is not so quickly that it's an alarm. But I do want to report that it is showing what the board intended to do, which was to draw down the balance in a meaningful way, but in a way that would not jeopardize the operations of the agency. Our approved expenditures for last year were 1,242,000. The actual expenditures were about 50,000 under. Part of that is because we had some money in the budget for temporary staffing. We also had some money for additional experts or any kind of legal cases if we needed to take those to different levels. So we didn't have to spend all the money. And just to remind you all, if we don't spend money in the BSRB fee fund, it doesn't go anywhere. It stays in the fund. So if we can find savings, we always try to do that. One of the major things that we've been working on behind the scenes that has taken a great amount of time. Every 5 years, each agency is required to perform a review of all of their regulations and put forward a report to the Joint Committee on Administrative Rules and Regulations for the legislature. This year we were up, and so by July 15th, we had to submit a report on all of our regulations, saying if they were necessary for implementation of state law, or if not, were they helpful, and then could these be revoked, and that kind of information. And so I do want to thank all the board members. We went through a lot of these regulations with the advisory committees over the last few years in preparation for this report. That made the work a lot easier. So we were able to identify a handful of regulations that we're in the process of revoking. The complication in that has been the state has switched over to the ESPR system for regulations. So it's an electronic system versus paper. But now the ESPR system is fully launched, so we are moving forward on those changes, but we were able to identify which ones we can revoke and which ones are necessary. And so that was about a 20-page report for the legislature. If they ask us to comment on that report, we will go in front of the committee. I will let you know, in the past, those reports at some point have been posted on the legislative research website, so I'll let you know when that gets posted. But if you have any questions, please let me know. In terms of some other updates, representatives from ASWB talked a little bit earlier in the meeting about the new examination that'll be launched in August of this year. ASPPB, the Association for Regulatory Boards for Psychology, is launching a new exam as well. That'll be next year, and there'll be more information to come on that. In terms of other updates, I did provide a second page for you. I got this a little bit earlier than I traditionally do, but I was able to get some information from our representatives that host our licensing system, and they were able to provide some information on the number of permanent licenses the BSRB issued this past fiscal year. So in fiscal year 2026, we were able to issue 2,109 permanent licenses. And by comparison, in last fiscal year, we were able to do 1,737. So that is a significant increase. there were about 400 or a little bit less, 350 more licenses issued in fiscal year 26 than there were in 25. Some of the areas where we've seen the increase have to do with addiction counseling licensure. There was an increase in master's and clinical level licenses that were issued there. Behavior analyst licensure continues to grow. Last year it was 200 that were issued. The year before it was about 150. We've also seen some increases in the other professions, notably professional counseling, clinical level especially, and then social work. I think there were about 100 more licenses issued for master's level social worker and clinical social worker than the year before. So that's great. Now there's always a combination. You know, we have more people seeking licensure, but we also have individuals retiring from the professions as well. So there is individuals who are coming and individuals who are going, but this is really good. And if you look at our trends of permanent licensure, you will see that has grown over the years as well. So just wanted to give you a little bit of information. The rest of the information in my report, please feel free to take a look at. I do my best to highlight important meetings we either staff on behalf of the BSRB or that I attend in my role as executive director. I can't spend time on all of those because of the time limits that we have, but I'm always happy to answer questions if you do have questions about any of those meetings. So with that, I will end my report and see if there's any questions.
Thank you, Dave. Any questions?
I don't have any questions, but I have a comment. I talked to David, or the other day, we were talking about some other things, and he told me that he had worked on the report that was due until 11:59 and hit send, so he could meet the deadline. So I just wanted to thank you for once again working so hard and doing exactly what needs to be done and coming in under the wire when you have to. So thank you for that.
Well, thanks. There are some late nights from time to time, but you know, if we have additional time, I try to make sure that things are looking as good as they can. But yeah, it was entered when it needed to be, but I appreciate your comments.
All right, thank you very much. We'll move on to the next agenda item, update from 2026 association meeting. Who's going to provide the Counseling Regulatory Board Summit update?
Okay. And I'll defer to the vice chair, Laura Shaughnessy. She is our board member for professional counseling, so I'll defer to Laura.
Thank you. So David and I attended the Counseling Regulatory Board Summit in Dearborn, Michigan. It was 2 days long and it was really productive. The entire conference was focused on supervision, which is something that our subcommittee is getting ready to work on, our advisory committee. And so it was perfect timing. It was robust conversations. It is always a balance of learning new things and then having validated what we do so well in our state. So it was just a really productive meeting and it was good. What else do you want to add?
No, I agree. I had some conversations after that meeting with some representatives of other counseling connected groups. There's a group called ACEs, and they have reached out to me to see if they can help us with any kind of data collection to address any kind of different topics. And we've also talked a little bit about maybe a forum to use more electronic processes involved with the supervision. So still exploring those opportunities, but I thought it was a really good summit. Unfortunately, by the end of it, I was feeling a little under the weather, but really appreciate them giving us that opportunity to attend, to connect and learn from other people, and then we can bring those back to the board. So the group from ACEs didn't have anything that they could give us that we could share with the board right now, but I do want to put it on your radar. There will probably be some things from a technology standpoint that they're working on that we can bring back.
Very good. Any questions about that? All right, we'll move on to updates on multi-state compacts, the Psychological Interjurisdictional Compact, SIPACT.
And board member Richard Nobles serves as the commissioner for SIPAC for Kansas. So I'll turn it over to Richard and he can share about the mid-year meeting for SIPAC.
Thank you very much. And yes, I went to the mid-year meeting last Monday. That was the 13th of July. And I want to thank the board again for delaying our meeting or postponing our meeting till today so that I might be able to attend that meeting. I will keep my report a bit briefer than I had intended to be mindful of time. We received a legislative report and it was noted that 7 jurisdictions had introduced bills to enact SIPAC in their respective states. A few of those bills failed. However, we will be onboarding 3 new jurisdictions. Alaska will become effective on 9/20. Iowa will become effective next year on 7/1. And Louisiana, which is, I think, the hardest fought of them all, will become effective on the 1st of January 2028, which would bring our numbers up to 46 jurisdictions that where SIPAC is located. And I hope that New York comes on board soon. We are awaiting the governor's signature to enact SIPAC there. That will be a game changer when it comes to some of the when it comes to patient care and when it comes to finances with SIPAC. In terms of just some numbers with respect to the state of Kansas, we onboarded 4 new individuals to have the authority to practice in the first quarter of 2026. We have currently 145 individuals that hold the telepsychology credential to practice, and we have 9 individuals that have the authority to practice in person in other states. So we are slowly growing, and that would be about, I think, 11 or 12% of the psychologists in the state of Kansas that hold the credential to practice between the two credentials. We also talked about our investment portfolio. I've talked a little bit about this in the advisory committee, but SIPAC has decided to switch its investment practices over to having it managed by a company called Integrated Financial Strategies. They presented during the meeting, and it was really informative in terms of what they plan to do to increase the portfolio of investments for SIPAC so that it can be sustainable for the future. And lastly, I'll just kind of breeze through this last point. We voted on a rule change when it comes to state assessment fees. So currently, all states are assessed a fee where the state must pay $10 per person that is licensed, and it goes back to SIPAC. Well, we approved a change to the formula where it could be that it would be $10 or nothing being charged to the state. So that was something that we did, and we also capped the amount that can be assessed per state to $6,000. And I can give more information in a written report if you would like.
Thank you, Richard. Any questions for Richard? All right, we'll move on to the professional counseling multi-state compact.
And for this, Laura Shaughnessy is the commissioner for Kansas, so I'll defer to Laura, and I have an update as well. So,
I'm excited to hear what your update is, because my update is there's no update. We're waiting on investigate the fingerprint investigation, and other than that, I think we're good to go. So
yeah, we're in the process of getting the privilege fee finalized here in Kansas as well. But the background checks, we've gone through a number of training opportunities, and so we'll be launching that shortly. But we are very interested in moving forward with the professional counseling compact. One small update, I serve as the alternate delegate, and Laura is the commissioner. They do ask each of the commissioners and the alternates to volunteer to serve on committees to help the professional counseling compact. So earlier this year, my term on the finance committee for the Association of Social Work Boards ended. And so I stepped off the finance committee there. They asked if I would serve on the finance committee for the professional counseling compact. And so I said I would be willing to do that. And so I'm a new member of the professional counseling compact finance committee. So I'm just going to try to help them look for opportunities for savings or smart fiscal policy approaches. So I just wanted to give you an update about that.
Okay, thank you. Any questions? All right, seeing none, we'll move on to the social work multi-state compact.
Okay, so I serve as the commissioner for Kansas, and we have two different committees that assist the work of the executive council and the commission itself. There's a rules committee and there's also a finance committee. And so for the social work multi-state compact, the finance committee has been looking at how much should be charged to fund the commission. There's different approaches. Some commissions have a flat fee they charge each state. Some do it on a transactional basis, and that's what this compact has decided to do. So once it launches, it'll charge an administrative fee whenever someone gets issued a multi-state license. And then that money for the administrative fee will come back to the commission to fund the salary for an executive director, clerical staff, legal counsel, the data system, and everything else. And so I've been working with them to find the right price point for that. I really think that compact, when it launches, will be very, very successful. So I had argued for a $10 administrative fee. Others had said that was way too low, and they argued for a $30 fee. So we reached a nice compromise at $20. And so that's what the approach will be when the compact launches. In terms of the rules committee, the reason why we have a rules committee is to make sure when the compact launches, we have very clear processes in place to do certain things. So one thing right now we're working on is a transition of multi-state license for people that get a multi-state license and then move from one state to the next, and how that multi-state license will be transferred from one to the next. There's also some information that we're working on as far as background checks. The social work compact didn't have any specific language allowing a grace period for when states are coming into the compact if they don't have a background check in place. That's one of the requirements of the compacts. Their licensees would not be able to practice unless we can figure out a good rule to address that. For SIPAC, they gave states a certain number of years as a grace period so people could jump in and start practicing immediately while the states sought that and some federal approval and things like that. So we're trying to find something similar in a language so that way when they go live, all the states can go live at the same time, not just a few here and a few there. So working on the background check rule. We're also working on a rule on adverse actions. There is a requirement that if you have had certain adverse actions in the past, disciplinary type things, you would not be eligible to practice under the compact if your license is currently restricted. But we need to have a clear standard and a clear process if someone wants to challenge that process, if they should be denied for a multi-state license. So we're working on the rule of adverse licenses. In the meanwhile, what has been going on at the executive council level is they have reached an agreement with the vendor for the construction of a data system. The reason the data system is important is that once this compact goes live, all the states will be issuing multi-state licenses and then reporting that information to the commission to be hosted in a data system so that people can go to the data system to verify if someone has a multi-state license to practice. It was a lot of work, from what I understand, to get that agreement signed. And the time frame for launching this, they're hoping to launch either at the very end of the year, but more likely it'll be the beginning of 2027. There was a special meeting of the council commission, the full commissioners, that took place in June. The reason why there was that meeting is because some of the commissioners were concerned that perhaps the chair of the commission was not going as quickly as possible in terms of negotiations on the agreement with the vendor, or maybe there were other reasons why things were not moving faster. And some individuals felt so strongly about that, they decided to put forth a motion to change leadership. Now, according to the bylaws, that was going to take 2/3 vote of the members. So they brought everyone together. We asked for an explanation from the individuals who had concerns. We asked for an explanation from the chair. And basically the chair said he was doing his best to make sure that the written document was drafted the best way possible, that the data system actually did what it was supposed to do, and that everything met the language. And so ultimately, when there was a vote, it would have taken, like I said, 2/3 vote to change leadership, and there were only about 10 votes of the 30 to 35 members that were actually in favor of making a change. So the people that were opposed to his leadership felt very strongly. I think a message was delivered, but I think the majority of commissioners felt like he should have the opportunity to continue to address some of these things, or that his explanation for why the time frame was what the time frame was sufficient. And so, so there was no change there, but it was an unusual meeting. I think this is a good opportunity for everyone to get reflection on this. I think from what I have heard and what I have done my due diligence talking to different commissioners, I understand why some people were concerned. But from what I have seen, I think it's just different personalities more than anything. I think the commissioner, the current chair, is very analytical, and he has a very technical background in terms of some of these processes. And I think he was doing his best to make sure that the commission was set up in the best way possible. But I think that meant there was not as much compromise as perhaps there would have been, which you can look at as positive or negative. But I think he was standing strong in what he believed to get the best commission set up. And so, so I think the majority of commissioners agreed that that was the approach, and so things are moving forward. The annual meeting this year will be another opportunity to get some feedback, and that'll be in November of this year. So I did want to take a little bit of time to let you know about that special meeting because it was unique. But I think things are in a good position now for us all to move forward. I'll continue to serve on both of those committees. I can tell you, as far as the progress in those committees, things are moving forward very, very well. And I think we're doing our best to be proactive to make sure we can have an effective launch either later this year or the beginning of next year. So with that, I will end my report on that compact and see if there's any questions.
Thank you, Dave. Any questions for Dave on that? Go ahead, Cynthia.
Do you anticipate that those commissioners who felt so strongly but did not prevail, are they going to remain in service, or are they going to resign?
No, I think that they will remain in service. To be honest, I think part of this probably could have and should have been addressed with a rule that clarified more of the role of the chair of that executive committee. I think, some of the things that they were critical of was that he was acting in a way that didn't include the full committee. And I think they wanted to be more involved in the thought processes, and there wanted to be more actions where the executive committee was making decisions. Whereas I think I feel like there was frankly some ambiguity in terms of what was the expectation for the chair. So I think he was doing what he thought was the best thing, but I think perhaps there could be some rules put in place that more clearly say, this is the role of the chair, this is the role of the committee. So I haven't heard that anyone on the committee is actually resigning. I just think that they expressed their frustration, they brought it to the commission heard from it, and then everyone is moving forward.
Of course, the irony is that whole process delayed things in itself. If the concern was about delay, all that kerfuffle created more delay, but that's the nature of the beast of collaborative work, right?
It's collaborative work. I mean, that part of that is that you have different people with different values and different priorities and different thought processes. And, bringing this all together and getting all the things established, once it's all established, it'll be clearer, hopefully, in terms of who's doing what and how things are supposed to work. But part of this probably exposed that there needed to be more clarity in the rule process or the role of the chair. Now, I can say from my experience working with other compacts, this is a vendor that had worked with other compacts, and it was my impression from what was said publicly that their preference was to push the social work commission in a direction the other compacts had gone. But this compact is different. This compact is structured like a multi-state license, and so I think there needed to be some differences in how this was going to work. So I am happy that it appears now that we're in a good position, but also that we are doing things based on the language in the law. Because it is a different compact, and I think some of those intricacies are important. So.
Thanks.
Thank you, Dave. Any other questions or comments?
I have one comment.
Go ahead.
I just wanted to say on behalf of the leadership of the Professional Counseling Compact, thank you so much for lending your fiscal responsibility and skills to the compact. You have a reputation on a national level for having a lot of integrity and a lot of skills and knowing what you're doing. So thank you for lending that to the compact.
Well, thank you, Laura.
Thank you. Yeah.
Very good. All right, we'll move on to our next agenda item, staff reports. Leslie?
I don't have any. That usually I tell you that the numbers are in the packet that you received from new licensing, but Dave went over that, so.
Okay.
Well, you do have your historical document as well.
Oh, okay.
Yeah, I highlighted the licenses issued during last fiscal year, but this gives you a nice 10-year history, so. But they still continue to increase. We reached 17,000 back in March, and now we're up to 17,358, so numbers continue to climb.
All right. That takes us to the Complaint Review Committee report.
Cindy, I think you may be muted.
Barely hear them.
Yeah, I can't really hear.
Their volume must be really low.
Well, Cindy, it's okay. We did talk before the board meeting. I'm sorry, we're still not able to hear you, but Cindy and I did connect before the meeting, and I can briefly summarize. There is information in your packet that has new information about the Complaint Review Committee for the board, the number of cases that have come in, the number of complaints that have been received, the number of actions, the number of open cases. So we are currently standing at about 350 to 360 open cases. That number has not changed it has changed over the last few months, but it has not grown. And so I think we are, with our current efforts, we're seeing that there's kind of stabilized with our efforts to make sure that we are, reviewing and making decisions on these cases. We have some other items for your approval or consideration later in the meeting, which I think help address that as well. But that information is there in your packet for your review.
Any questions or comments on the info in your packet? Mary, anything you want to add?
No, just thank you to the Complaint Review Committee for all the work that takes place. It is a heavy lift in a lot of cases. The committee takes that work very seriously. So thank you to all the members who participate in that. It's a great group, and we're doing a lot of really good work, and I think we're trying to work very expediently as well. So thank you for that.
All right, thank you. We'll now move to professions reports, starting with licensed psychology. Richard?
The Licensed Psychology Advisory Committee met on Tuesday, the 9th of June, 2026 at 6 p.m., where we discussed a timeline for the development and the launching of the integrated EPPP. So that's the National Licensing Exam for Psychologists. There will be beta testing in March of next year, and they hope to go live in the fall of next year. Also, we talked a bit about the increase in price of the EPPP. Is going up $50 from $600 to $650 once that process is done. And I will keep you posted as to whether or not there will be other matters, as Dave will also, because he serves as the representative for Kansas with ASPPB. We'll continue to apprise you on the development of the EPPP. We also discussed artificial intelligence and its integration into clinical work, and there was a robust discussion about the types of parameters we might want to put into regulation with respect to artificial intelligence. So committee members were asked to consider other advantages and disadvantages with respect to the integration of AI into clinical work. We also discussed changing the postdoc requirement here in the state of Kansas, and that has been an ongoing matter that we have discussed. And we asked committee members to, again, weigh the pros and cons of eliminating the postdoc versus keeping the postdoc, especially as there are a number of states that are around us that are eliminating the postdoc. With that being said, we will meet again on Tuesday, the 11th of August, 2026 at 6 p.m.
Thank you, Richard. Any questions for Richard? Seeing none, we'll move to a report from the social work.
Yeah, the Social Work Advisory Committee met on June 2nd, and we had kind of an abbreviated early part of our meeting because we had 72 applicants for our advisory committee positions. We did have our usual report from David, and I was able to give a report about our Leslie and mine's attendance at the ASWB education meeting back in April. But then we did spend the majority of that meeting talking about and selecting our candidates from those 72, which I was very happy we were able to conclude in the course of that meeting. We tabled our ongoing discussion about AI, which we will resume at our next meeting, which is on August 4th. But I did want to share with the board that Frederick Reamer, who's a professor of social work in Rhode Island, and has been an expert and a specialist in ethics in behavioral sciences. He has a new book out about ethics in the use of AI in the behavioral health professions. I'm going to be talking about that with our advisory committee, and just wanted to let you all know that because I know similar discussions are going on in other advisory committee meetings, and I think it could be a good study point for us going forward. Dr. Reamer came and presented some years ago at a KNASW sponsored conference, and he's excellent. So I expect this to be a really good resource for us. We will meet again on Tuesday, August 4th at 10 a.m.
Thank you, Cynthia. Any questions for Cynthia?
I'd be up for that book club.
Okay. Yeah, I actually thought, that might be a good option for anybody that wants to have a separate opportunity to read that book and discuss it, that would be a good way for us to pursue this topic.
We'll move on to professional counseling.
Thank you. The Professional Counseling Advisory Committee met on June 7th. Our topics were AI supervision. We have formed a supervision workshop or work group. We're not going to call it a subcommittee. It's going to be a work group so that people can plug in and contribute as they are able. Doing a Doodle Pro to get 7 people to join was almost impossible, so we're going a different route. We elected or recommended 2 committee members to the advisory committee, and we'll be talking about that later. We looked at telehealth supervision. We had a presentation regarding telehealth supervision and are really taking that into consideration. Let's see, what else? I'm trying to think if there's anything else. Can't think of anything else. Our next meeting will be August 10th, 10 a.m. Thank you.
Thank you. Any questions for Laura? All right, we'll move on to master's level psychology. The LMLP LCP group met on June 3rd. We had a discussion on advisory committee membership. We're recommending adding 1 member and continue to look for 1 additional member for our group. We also discussed and decided to move to quarterly meetings. We will retain the option to return to every other month if needed, but after doing all the work on kind of the regs, we felt like we're probably in a place now where we can meet less often and still kind of keep up with what we need to. We also had a brief discussion about the upcoming BSRB strategic planning process and what the point of that was going to be for the board as a whole. We will be discussing having continued discussions on an alternate path to licensure during our next meeting, which I believe is scheduled September 9th at 10 o'clock. We'll move to marriage and family therapy, Mary.
Thank you. Marriage and Family Therapy Advisory Committee met June 5th. We also discussed AI and went back to that conversation and are continuing to keep that discussion alive. We were kind of looking for open topics for the future meeting. I think we all feel like there's a lot of work that has been done and we need to continue to evaluate what would be meaningful for that committee. We also did talk about our meeting frequency, but decided not to make a change yet. We also had applicants to review, and we had discussed the way in which we're going to onboard or bring on new members that are in a staggered way. But we will talk, I think, later on down in the agenda about some of the discussion points around reviewing potential applicants for advisory committee. And so we'll have recommendations probably following the next meeting, which will be August 14th at 10.
Thank you. Any questions for Mary? We'll move on to addiction counseling. Jill?
Good morning. The Addiction Counselor Advisory Committee met for our regular 2-hour meeting on June 15th and again for a special 1-hour follow-up meeting on July 14th. And based on our meeting today, you can tell what our discussion was. We, as far as I know, have not set a meeting date for our next meeting. I believe it will be in September, but we will be reviewing applications for open positions on the advisory committee. We will continue conversation about AI and likely will provide an update regarding the conversation today about potential changes to the student temporary addictions counselor license. And I think that's it.
Okay, thank you. Any questions for Jill? Seeing none, we'll move to behavior analysis. Linda?
Yeah. So we met on June 12th at 1, and it was a pretty status quo meeting. Nothing really exciting happened. We did elect a new committee member, which we'll discuss later in the agenda. After that meeting, though, there was some information that had come out from KDADS, and so I pulled David and Leslie on a group sort of like with the addiction counseling, where they were trying to come in with through a different path to be able to get people with different credentials eligible to provide services. So I'll let David talk about that, David or Leslie. But sort of mixed, the other thing that's somewhat mixed in there is that there's MCO changes with regards to licensed master's level psychologists about their scope of practice and what's permitted under CanCare MCO and what's not. It was a pretty eventful post-meeting couple of weeks with several different meetings. David, do you want to chime in anywhere on that, or Leslie?
Well, we do have this listed as an item under new business in terms of a recommendation on next steps. So I'll probably wait till we get to that item under new business, but definitely some complex type things that I think will be benefited from some additional follow-up for sure.
I totally agree. So we'll wait until further in the agenda, and then our next meeting will be Friday, August 14th at 1. And with that, I'll end my report.
Very good. Thank you, Linda. Any questions? All right, we're due now for a 10-minute break. Let's be back at 11:58.
11:58 it is.
It's just about that time to stand and stretch, wasn't it, Leslie? I was like,
My sciatic nerve was starting
love to know where Jim is.
See off traveling somewhere again.
Of course.
It's so wonderful, exotic place.
Yeah. Sounds heavenly.
Where it's not 150 with 90% humidity.
I think we should be back.
All right, looks like we got a few people rejoining. Richard, can you hear us okay? Thank you. Gonna give people just a minute to rejoin.
This is my computer. I'm gonna need you.
I'll just have to take mine and walk it out of the room.
Okay, mine's on nil. That's what I was.
Yeah, it should be fine.
Chargers. I don't carry it, so I don't use it.
You don't care what seat I'm
My charger for my computer, because it hooks up to my docking station here, but.
Oh, so you don't walk away with it?
Yeah.
So it doesn't wander off.
Yes.
All right. Looks like most everybody's back. Okay, we are now at old business on our agenda, although there are no items listed under old business.
And then actually one item right about old business.
Oh, I'm sorry. Yeah, I'm trying ahead of that. Executive session, we are going to go into executive session for 10 minutes for consultation with board attorney.
And I have a motion here. I'll read off this motion and see if a member of the board would like to make the following motion. Pursuant to KSA 75-4319, the board member would move that the board recess into executive session for 10 minutes and reconvene the open meeting at 12:12 p.m. The meeting will be reconvened remotely by conference call at 1-877-278-8686, PIN number 327072, and by Zoom as directed in the notice of meeting that was sent to individuals who requested notice and is published on the board's website, ksbsrb.ks.gov. Justification for closure is communication with legal counsel that would be attorney-client privilege communication. David Fye, Executive Director for the BSRB, and Tim Resner, Legal Counsel for the board, are to be included in the executive session. The subject to be discussed is in the executive session is consultation with an attorney, which would be deemed privileged in an attorney-client relationship. So would a member of the board like to make that motion?
So second.
Very good. We have a motion and a second. Any further discussion?
And Dave, just for our minutes takers, it sounded like the motion was from Denise and then second to Mary Jones.
Yeah.
Okay.
All in favor of the motion, please say aye.
Aye.
Opposed, same sign. Motion carries. Thank you.
Okay, and just as a technical, you all should have received an email from me this morning with a different Zoom for the executive session. So if you are on the conference call or if you're on the Zoom link, go ahead and exit this Zoom and then enter the other Zoom from the email below. We will go ahead and mute the conference call line and stop the recording so we can enter the executive session. And after 12:02, we will all come back to this Zoom. So the YouTube broadcast will continue, but it will not include any information from the executive session.
When I look up there and I see me, that looks like a seatbelt.
Yeah.
Thing.
Is that a new and improved one from the last time? No, I think I remember the microphone.
Yeah.
action. That's what I was trying to remember. I was like.
Oh, I see it.
Okay.
Keep looking, thinking, what is that?
We should be back.
You have an extra special microphone.
Yes.
Can you all hear us okay? All right. Are we good to go?
I think we're good.
Okay, welcome back all. Thank you. Now we're at the point on our agenda for old business, but we don't have any old business to discuss today. So that moves us to new business and the appointment of new advisory committee members. Are you going through the list or you want me to do?
I can go through the list, sure. So officially, as chair of the board, Dave Anderson has the authority to appoint new members to the advisory committee. So Dave will be appointing the following individuals to the advisory committees. For the Behavior Analyst Advisory Committee, Paige Boydston. For the Master's Level Psychology Advisory Committee, Nicole McLean. For Professional Counseling Advisory Committee, Teresa Patterson Marsh and Joshua Paskowitz. For the Social Work Advisory Committee, Tiffany Gleason, Jenny Marsh, Jessica Snyder, and Joshua Robertson. And as was mentioned earlier, there were several individuals who applied to the advisory. 72 alone for the Social Work Advisory Committee. So we want to thank everyone. I've been in contact with those for the Social Work Advisory Committee. For the other committees, I'll follow up with them to let the individuals know next steps if they were appointed. For individuals who were not, I will encourage them to apply in the future, letting them know how many good candidates we had for this time around.
Very good. Okay. We'll move to election of BSRB chair and vice chair.
And Dave, in your packet of material and board members, every year at the first election that starts after July 1st, KSA 74-7501C talks about the board organizing at its first meeting and electing a chair and vice chair. So I think the next procedure would be to open it up for board members for a nomination for chair. And then after that's decided, to open it up for any nominations for vice chair.
Is this where we say we nominate our current slate of officers?
Well, if you would like to nominate the current chair to continue, you're welcome to do that. If you have other nominations, you're welcome to do that.
I'd like to nominate Dave. So do we do Dave and then Laura?
Yes, so it is the chair first, and then it is the vice chair. So we would open it up for any nominations, and then after that's resolved, we'll go to the next. And this is a procedural. These basically are effective after the end of the meeting in case there would be any change, board leadership. So.
All right. Well, Dave, should you be willing, I would like to nominate you to retain your position as chair.
And I would second that if it requires a second.
Thank you. I am willing to do that.
Yay.
And are there any other nominations for chair? Okay. If there's no more nominations, it appears to be the consensus of the board to re-elect Dave Anderson as chair of the board.
Yay.
So congratulations.
Thank you.
And then the next step would be to accept nominations for vice chair.
And I would nominate Laura to continue as vice chair.
I'll second that.
Are there any other nominations for vice chair? Okay. It appears to be consensus for Laura to continue as vice chair. So congratulations, Laura Shaughnessy.
Thank you.
Congratulations.
Thank you for both being willing to serve again.
Yes.
Thank you all. That takes us to a discussion on possible changes to BSRB investigation policy. Delegation motions, Dave?
Thank you, Dave. So as we have been researching ways to continue to become more efficient with our processes, you have each received a copy of the investigation policy that is posted on the board's website. To basically review this policy at least once a year, looking to see does it currently reflect the best practices? Are there changes we can make to help with different things? One thing that I've talked with our legal counsel about and with a few different board members about is we do tend to see some scenarios happen from time to time, which appear to be of a technical nature and appear to have a lot in common. For example, we audit 10% of our licensees when they renew their licenses, when they renew their licenses. And so, as part of that process of the audit, they have to show demonstration that they've completed all of their continuing education hours. From time to time, individuals do have some trouble with those hours. Either they can't produce documentation to verify that they have finished all the hours, or potentially they missed taking an hour in a certain category that was required, but they have other hours. And so we ask that individuals comply with the audit process. But then if those individuals have had issues, they are investigated, because under the law, that is a violation of unprofessional conduct if they're deficient in their continuing education hours. And then that is ultimately decided by the CRC, the Complaint Review Committee for the board, what the process should be. But we have certain cases that happen from time to time where individuals have, an issue with maybe half or less of their hours. And the question is potentially what the board could do would be to have a standing delegation motion to allow staff to execute a standard practice when we see certain things occur. So for example, when it comes to something like continuing education hours, potentially what the board could do would be a delegation motion that says, if someone's audited, we find a small issue with their hours, let's say that there was an issue with less than half of their hours of their continuing education requirements. They had not previously had a violation with the board and not previously had a warning. Potentially that could be a standing delegation motion to have a warning from the board. And we could even have those basically approved by the chair of the CRC. If we want to have a board member have a designee to basically have a different review process. But that would be able for us to work with those individuals on the continuing education hours, rather than those all being brought forward through the investigative process and brought to the CRC. So the current language in the investigation policy doesn't really talk to this. So to implement this, what I believe would be necessary would be to get a motion from the board as far as saying, at its discretion, the board could authorize standing delegation motions to be executed by staff in lieu of the traditional continuing, in lieu of the continuing or the CRC process, basically. So one example would be the continuing education hours, and that is just an example, but it could be something that we start to think about, or it could be a motion today that if someone has no previous violation, no previous warning, it's their first time with an issue with their CE hours, it's less than half their hours, that could be a standing delegation motion from the board. Another scenario that we see from time to time with some similarity are individuals where, let's say, their license has expired. They continue to practice for a short period of time. They reinstate their license, but there may have been a short period to where they either represented themselves professionally or practiced while their license was expired. Another example of a standing delegation motion could be if it was something like less than 30 days where the person was practicing or holding themselves out. There could be a standing offer for a diversionary agreement. And then if the person did not want to pursue that path, as an alternative, we could say it can go through the traditional complaint review committee process. But if they had no previous violations, no previous warnings, it could be a way for staff to work with that person to kind of move through the process more quickly, if that would be something that you'd be interested in. So I wanted to bring these to you as two solutions. Or options, I would say, but I think they would require a vote to modify the investigation policy. And then those would be two concepts that I wanted to bring to you to get some feedback on. If you like those and you want to move on them today, there could be motions to go ahead and do that. Alternatively, if you didn't want to vote on those today, or they don't sound like a good idea, we don't have to do this, but we're just trying to look creatively and trying to find consistency to make sure that the complaint review committee can really focus on some of the real violations outside of some of these technical type issues. So.
I would certainly weigh in and say that I think the two suggestions you've made are very well informed, and I think they would take a lot of work off of Cindy and Joan to be able to work with the higher level investigations. And I think the things we get, and they then think about from even the licensee standpoint, they're in this limbo land for something that's really, like you said, technical in many ways. And the complaint review committee is generally looking at the same outcomes in terms of how we handle those. So I think this is a smart thing to do. And I was looking, because I can't remember on this report, but I know I've seen how many of the CEU violations we have, and then how many of the expirations we have that'd be less than 30 days, just to see, you know, what kind of impact that would have. But you may not have that data readily available, and I'm sure Cindy doesn't offhand.
Well, if you look at what the diversions are, if you look at what our diversions are.
Those are almost all, yeah.
Yeah, so if you look at our diversions, those are gonna be expired licenses and CEUs together.
Okay.
'Cause
So that's a good example of taking things to where if someone in this office that where you don't need the higher level investigative work could perform those things, I think. But
So first of all, I support that as well. But the question I had was, when David mentioned whether or not the chair of the complaint review committee would want to review any of that.
I mean, I think that's the board's discretion. If we have parameters built in, for example, on the CEU, I mean, I'm happy to do it. And I think if it felt like a good touch point, it makes sense. But I also think some of these are so routine. I'd be open to the discussion of the board, knowing that, you know, would be what, 35 on average total so far this year of things to review.
Well, to your point, there's a pretty standard process
Yeah.
established for how these are going to be dealt with.
I think
Other
it
feedback?
makes total sense to do that. But I would want there to be the option that if the staff saw anything sort of irregular in those otherwise kind of standard issues, that they would have the option to refer it to the CRC.
Keep it active.
Yeah, I mean, if we set the parameters clearly enough, that would probably be a rare situation. But, you know, if there were complicating factors and why they didn't get their CEUs or why they didn't renew within 30 days after their expiration.
Yeah, and there's always the chance that they wouldn't agree to the terms that are being offered, and so then that would have to come back to a more formal process too. But yeah, I think if the parameters are clear and we're talking about these specific type of violations, it makes sense in my mind.
Yeah.
Other board members want to chime in?
I just
would be. Oh, go ahead.
Sorry, Richard. I was just gonna say, I agree with Cynthia that we have the standard practice, but there's the option to refer back if there's a question. That is providing structured support to the staff members so they don't feel like it 100% falls on them if there's something out of the ordinary.
I was just gonna say that I would be prepared to make a motion for either one of those or both of those if we want to combine them.
Did you have suggested language, Dave, on that language to change the policy first that we could address?
Yeah, I don't have the specific language, but I would say conceptually, if a board member wanted to move that we add language to the investigation policy that says at its discretion, the board could put forward standing delegation motions authorizing BSRB staff to execute agreements with the terms of those delegation motions with the review and approval by the chair of the CRC.
Okay, yeah, I would move to implement the language that has been proposed by the executive director, or that could be proposed by the executive director.
Second.
Okay, we have a motion and a second. Any further discussion? Seeing none, all in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Thank
Can
you.
I say one quick thing with respect to that? I just want to reiterate Mary's point about how this will take weight off of our investigators. We get a number of these, and I think that this is a good way to lighten some of the load that both Cindy and Joan carry.
Thank you, Richard. I do want to ask you, there's a couple scenarios that I brought forward. I'll tweak one of them and see what you think. Basically concerning the topic of continuing education hours, if someone is selected for audit and there's an issue with half or fewer of their hours, there could be, as long as the person had no previous violations, no previous warnings, there could be a standing decision by the board to send that person a warning letter.
Okay.
If they had an issue with more than half their hours, but they had no previous warnings or issues, that could be dealt with separately, perhaps a diversionary agreement that would require them to be audited twice or something else. But I was thinking, at least if there's an issue with half their hours, there could be a standing warning letter or something else.
So David, your
But-
scenario that you're suggesting, you're thinking about the scenario where they missed hours but had made them up already.
Correct.
Because in a warning letter, then we can't ask them to do things.
Correct.
So, okay, I just
So-
wanted to clarify, point of clarification.
That's a very good.
Right, yeah, I'm glad you clarified that because they need to have done the hours, made up the hours before we give them just basically a warning.
Yeah, correct. This would be a situation to where someone had no previous violation, no previous warnings or diversionary agreements. And they did comply with the audit in terms of, following up with our staff, finishing the hours eventually, even though they were late. So that would need to be a requirement. But if it turned out that they had renewed, but they hadn't finished their hours before they renewed, that's currently a violation. So if the issue was they were a few hours short or they had taken hours that didn't count for certain categories, that's kind of the first situation with the warning letters.
Okay.
And just so the board is aware, when someone is short on their audit or did hours outside of their time frame, our staff standard reply is to tell them they have to make up the hours, and then they'll go to the investigators for.
Okay.
So that fits well with.
Yeah, I was gonna say,
Yeah.
so, yeah, most of them will unless there's an extenuating thing, so.
Yeah, if someone is non-responsive to the audit, that will still go through the regular process. So this
Sure, of
assumes
course.
they'll comply with the audit. Yeah. Okay. So maybe.
So do you need a motion to accept that?
Yes.
So moved.
I'll second that. Oh,
Do I have a motion and a second? Everybody understand what we're about to vote on?
I wonder, as point of discussion here, if we could have a proposal or maybe a smaller group work out the details. Because truthfully, the complaint review committee has a fairly standard set of things that we do. And I wonder if we try to prescribe right now, if we might make a misstep in that. And so if we could maybe have a small group of us inform a decision to provide some suggested language. The board could even delegate that to the next CRC meeting and we could approve that. Or we could bring it back to the board, whatever the board's will is. But I do think it would be more helpful for my thinking through what we typically do. And I might even have some, even broader recommendations around like the 30-day mark that your staff could carry forward. But if the board's okay with that, I think if the policies change, that allows us the opportunity to craft something.
It makes sense too that the CRC
Yeah.
develop that language.
Yeah.
Are you okay
That's
with that?
perfectly fine with me. Yeah. I think
Okay,
it's a
so
good
I
idea.
can withdraw that motion then.
Very good.
And we can work, we could work on some suggestions before the CRC meeting. I have no idea when it is. I'll have to look at my calendar, that way we might be able to expedite some conversation there too.
Yep, should be the second Monday in August.
Okay.
The 12th. So
All
I
right.
just want you to be gentle on the people that are within 30 days of an expired license.
Yeah, we generally are.
Yeah. And consider using their original licensure date and because now if it expires, they get a different licensure date. And that messes it up when you're trying to enroll with insurance companies. If you have a requirement that you have to be licensed for 5 years.
Continually, right?
Yeah.
Well, that's a bit of a natural consequence.
Yeah.
Okay.
That's true, but I just have to say it happened to me.
Well,
But somebody had submitted it and they did not.
we'll evaluate that within the confines of the statutes and regulations.
Thank you.
Yeah.
Right.
Okay, well, thanks for your discussion. Yeah, I appreciate it. We'll modify the investigation policy and then we'll work on those discussions for specific things.
Perfect. Thank you. We'll next move to review of recommendations from advisory committees. First, a discussion on possible changes to student temporary addiction counselor license from the Addiction Counseling Advisory Committee.
And I think all of this was framed earlier, but Jill Flessing as the chair of the Addiction Counseling Advisory Committee, in her role as chair, she effectively relays the recommendations back to the board. So Jill, was there anything you wanted to share with the board or anything we didn't touch upon earlier during the presentations?
No, I think it was pretty well laid out, as well as I just want to emphasize that I didn't get the feeling that there was anyone on the advisory committee who was in support of reducing education requirements, of removing the age requirement. There was discussion about how the addiction counselor license came to be, and how also was mentioned that for mental health counseling licensure, we require at least a master's degree. For addictions counseling, it's a bachelor's degree, so it's already like a lower standard of education, and to reduce that further just seems risky. And I want to continue to really, of course, as we all do, emphasize that if our role is to protect the public, I'm not sure that reducing the age requirement and education is doing that.
It's also deprofessionalizing. I mean,
Yes.
I'm old enough to have worked before there was in addictions, long before there was any licensure. And what they were proposing it's essentially, hiring someone as an apprentice with zero skills or knowledge, and to put them as primary counselor.
Yeah.
I mean, I'm thinking about the people I know that have gone through addiction treatment, and an 18-year-old with 18 hours of whatever it's not even prescribed coursework, they would have eaten them alive. I mean, there's no way that you could, even under supervision, if your supervisor's sitting there right with you in the session. So yeah, I wondered if, they kept talking about having to go on hold and not being able to admit people, but I wonder if those people that they had to turn away were able to get treatment in other places, because we were hearing that there was some skepticism about whether there was really a workforce issue in addictions. What's your understanding about that, Jill?
Well, my understanding is from the advisory committee, because I don't work in a treatment facility, but there were others on the advisory committee that also questioned whether there's really, really that much of a workforce shortage. And I would imagine Acadia is not going to say, and they may not know, whether folks got treatment elsewhere. But it just, it seems like it's pushing our field backwards.
Hmm.
Because
agree.
I mean, I started in addictions when I had a certificate under CAP, and I had a credential, and then we transitioned to licensure. And I remember when I was a new addictions counselor, older addictions counselor saying this is all kind of willy-nilly and not really standardized, and now it feels standardized, and it feels like there's an education requirement, and this is not it.
Yeah.
Does not align with that.
If I'm not mistaken, I mean, I'm pretty sure they said the last hold was in 2023, so it hasn't been something that has been,
Recent.
like this. It sounds more to me that it's a billing issue, and that really doesn't tie.
Yeah, our job isn't to help them
unfortunate-
bill, right?
It's unfortunate, because it's hard to hire staff that don't bill, just from a pure business perspective. So I can definitely understand that, but I don't think that that's enough to minimize or decrease our standards, in my opinion.
Yeah, agree. Standard of care.
If I could just add to what Jill mentioned in terms of the advisory committee, there was a pretty robust discussion about outcomes as well, and that goes into the patient safety or public safety trust. But there isn't, there really are no outcomes in terms of reducing educational hours or age restriction. And when they provided information on the other states that were doing something similar, it was really related to credentialing and internship, which isn't what we're talking about here. So it was like apples to oranges kinds of comparison. So I think without really knowing what this would do, it's scary.
That's how it feels to me, is scary when you look at really what their requirements are and the amount of education, but you compare that to their job description and what it is they're supposed to be doing.
Right.
And really the credibility of you got a 45-year-old person that's been an addict for 25
Right.
years, and they're put with this
Potentially 17-year-old. Yeah.
this person that's still wet behind the ears. I just don't see how that has the ability to really produce robust outcomes. The question is, David, how do we preserve the integrity of what we have now while working with them? Because the option is going to be to kick it to KDES, right? So it's not a license, it's a certificate. But yeah, so is that just a way to circumvent licensing?
If KDADS would approve it, but I mean, he said they were neutral right now, but
right.
That seemed strategic to me.
I think
to say that they were neutral.
Yeah, and I work with KDADS a lot, and KDADS gets a lot of pushback from the field from people who are billing MCO, through the MCOs and Medicaid, to be able to have warm bodies in places that they're able to bill for. And so KDADS tries to be responsive to them. It's like the balancing act between maintaining our integrity and the integrity of this particular license, while at the same time, I mean, they went straight to the legislators, right? So how's that going to work, David?
I don't know. we set this, well, this deadline was asked of us, July 31st.
By the legislature, right?
Right. Now, the legislature is not meeting again until the spring. I do feel like, given the letter that was agreed to, and officially that letter was signed by the BSRB and by Travis Lowe on behalf of Acadia, and also by the addiction professionals, that we would continue working together. There were other individuals that part of that process that were stakeholders, but they didn't officially sign off on that letter. But I think we do need to present something back by July 31st to honor that agreement that we worked together. Um, I don't know what the answer is, because individuals can go before legislative committees and request introduction of bills. I do think we've demonstrated that we do want to work together. We've had multiple meetings. I tend to think that there are some other solutions that we could continue to explore. It sounds like KDAS is really developing that behavioral health technician program, and I don't know for sure what will meet the different needs of Acadia, but it sounds like they're looking for different types of positions to meet certain needs. I would be willing to use my time to continue to meet with them this fall. I know we had all kind of talked about coming to some sort of a consensus position by July 31st. But it does sound like people are in different places. So,
Yeah, I was just gonna add from the discussion, and I think, thank you, Dave, for that, the discussion point of, it doesn't sound like there's going to really look at much movement from the side of CAP or the advisory committee. It sounds pretty firm on that. Having said that, I do think it's a good idea to continue to touch base with this group to see if they're proposing legislation. And ultimately then we would decide at that point what type of testimony, if any, we would want to provide. And I think whatever avenues are looking at, I think, from my perspective, I think KDAD's stance of neutrality is pretty normal, as a state agency, not weighing in one way or another. As having the licensing regulations, it makes sense that they would have a neutral, in my mind, a neutral stance. So I think that's appropriate at this point too, just to hear what the concerns are from the field. But I think, yeah, we're subject to anyone who brings a piece of legislation forward, and decide and weigh in on that at that time, what makes sense.
Yeah, I think kind of nudging them back towards KDADS to see if that behavioral health technician kind of fits what it is they're trying to do. I agree with the earlier point that this is not a profession, and this is not a professional kind of degree or licensure that they are looking at. I was mostly against the student thing for the same reason. It just felt like, these kind of addiction issues are extremely complicated, and people deserve to be, to know when they go in to get treatment in the state of Kansas, it's going to be by somebody who has the experience and education to be able to help them through really difficult and complex issues. And it kind of boggles my mind that they would put forward, no age limits, very little training, and to give them a position where they would be in charge of somebody's treatment, not helping with somebody's treatment, not an adjunct to that treatment, but in charge of their treatment. It does not seem like a position that we could take where we could defend that we are protecting the public interest.
Yeah. I completely concur. I think that it's untenable. And I agree with what folks are saying. And I would just add, this is a particularly vulnerable population.
Yes.
And what Dave just said about the complexity of working with these individuals and having the trust that the individual can help them through what can be a lifetime of these engaging in these behaviors and having these difficulties. it is, I think, untenable to say that with this particularly vulnerable population, we are entrusting someone with this little education, with this little experience to be in charge of this person's care. Like, I can't get on board with that.
Yeah.
Do we need, Dave, to take any formal action on accepting the recommendations from the advisory committee?
I think in this situation, given the unique circumstances, it would be good for the board to take a vote. Whether to concur with the recommendation to make no changes to the student temporary license at this time, or to do something different.
So moved.
Yeah,
Second.
Yeah.
Okay. We have a motion and a second. Is there any further discussion?
And just to clarify, I did include to not make any changes or do something different.
Oh, I'm
It sounds
sorry.
like the motion was to not make
So it would be to not make any changes to the student license at this time, but to remain in discussion.
That's
That's
probably
a
not-
separate issue.
That wasn't the recommendation, was it?
No.
Well, he had two
We're adopting or not their recommendation.
Our recommendation was that no changes be made to the student temporary
And that's the
license.
motion.
But I
Correct.
think we as a board can invite David to continue that discussion.
But that's not the motion.
Right.
The motion at hand is about accepting the recommendation. If we want to direct David to continue discussion, we can do that separate from the motion.
Correct.
Separately, right.
Yes.
Okay, so we have a motion. Do we have a second?
So moved.
I seconded it. Yeah.
We have a second. Is there any further discussion? All in favor of the motion, please say aye.
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 Opposed, same sign. Okay, motion carries. Thank you.
I wanted to tell the board, because I did speak at the committee meeting. The states that they're looking at are not licensed, not all licensed. They have steps and they're credentialed or certified, and the lower their education dictates what they can do as they're moving toward their credential getting, because they have to have something to get the hours, because they do a lot of hours in practice. But when Dave said that KDADS, if it's a certification for a technician or even an addiction specific one, then that would seem more appropriate than our board.
I like what Jill said, being an outlier is not always a bad thing.
No.
Yeah.
Most of the states that I looked at that have licensure, they license at the master's level and above. They don't license the bachelor's or lower.
So in a lot of ways, we're already.
Already there.
Yeah.
The other, the one other thing that was a red flag for me was what we heard about them having had multiple violations in their other facilities and even been shut down in other states. So, I mean, this whole request, to basically prop up their business without even knowing if really the people that they have had to turn away because of workforce shortage weren't able to find care elsewhere. That just feels a little bit too much like a for-profit business trying to buy their way into being able to practice in what we seem to feel is a substandard way.
Okay, and the issue of time, since we're rapidly running out of time, is there anything else you need on that?
Just really quick, as was mentioned, originally Acadia came to KDADS and was trying to work through a path. And so that is why we were not part of the original discussion before the bill was introduced. So our working with Acadia has been less than a year, maybe potentially less than 6 months if I'm looking at my calendar correctly. So I would like to continue to work with them if I can be of assistance to help them. I don't want to take too much away from my other responsibilities, but if it's okay with you, I'd like to be able to share, especially in the letter back, that we would still like to have spirit of cooperation, working together, and I'd like to continue to work with them to see if I can be helpful at finding a solution for them.
I definitely agree with that. David, would you also include the subcommittee, the advisory committee? Jill's in that process?
So we could include that. I know the advisory committee will probably have some other topics to work on, but I'm not sure. I know we were originally one of the stakeholders, so I want to make sure that, we're represented, but do you have thoughts on that, Andre?
Sorry, I just meant as appropriate, not that they have to be engaged in every piece of it, but it would be nice to have that filter
Input.
of advisory committee weighing in on what they would like to do moving forward.
I would like to remain informed about what they're doing. So if David has the time to continue hearing what they're saying, what they're proposing, I think the advisory committee members and I would certainly appreciate that. And if they need our opinion or want it, absolutely come back to the advisory committee.
It appears to be consensus of the board to go ahead and continue to work with them, and I'll make sure that we send back something drafted with the other stakeholders by July 31st as well. So.
Very good.
Thank you.
Great.
Thank
you. Thanks for the very robust discussion on that item. That takes us to a discussion on advisory committee applicant review process by the Marriage and Family Therapy Advisory Committee.
In the interest of time, do we want to table this discussion or do we want to go ahead and move forward?
Either way is fine with me.
You want to table?
Yeah, I think we table just because there's a few points we want to probably talk about.
Very good. How about in terms of the next item, creating a subcommittee on behavior analyst services by the Behavior Analyst Advisory Committee? Are you okay with tabling that, or do you need to?
Actually, I can summarize a little bit. I just want to make sure to get board approval to continue to meet with KDHE on some of those items. And I'd like to be able to add a couple people to that conversation, perhaps from the advisory committee. Some of this has to go towards what KDHE is proposing on changes to the state Medicaid plan.
Okay.
It goes back to the underlying diagnosis for certain behavior analyst services being provided. And so I do think it's important, and I want to make sure that we meet with them, but I wanted to make sure we brought it all to you to make you aware of this. So we'll be going and collecting more information and meeting with KDHE, if that's okay with all of you.
Do you need a motion?
So we'll just make it an informal working group instead of a subcommittee, if that's okay with you. That'll give us more flexibility to meet with KDHE outside of a standard, official committee of the board, if that is okay. And I think if it's consensus by the board, there doesn't need to be an official motion.
Right. Consensus.
All right. Everybody okay with that?
Mm-hmm.
Thumbs up, nodding heads. Okay, very good. Reminder of our upcoming out-of-town planning meeting on September 27th in Leavenworth. Dave, is there anything you want to share on that?
I've been talking with the host for that conference date, and basically we are looking like we are going to be starting the traditional board meeting the evening before, so Sunday evening on the 27th. And that'll leave us most of the day on the 28th to talk about items that require more in-depth discussion. And we'll try to gather some other end of the year information so you can have some statistics to review on our processes, and we can have the strategic plan conversation. So looking forward to that. The deadline, I was told, for us to secure the rooms, it would be September 1st. So we have a full month, but I'll be checking in over the course of the month just to get confirmations.
What time will that start? Sunday evening?
Sunday evening, I think we had talked about 5:30.
Mm-hmm.
Yeah.
All right. Right under the wire.
Guys are good.
If there's nothing else, I'd accept a motion for adjournment.
So moved.
Second.
Okay, we have a motion and a second.
And a third.
All in favor, please say aye.
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 Aye. Aye. Thank you all. Appreciate all your time and energy. Look forward to seeing you in September.
Stay cool.
Right?
Right.
Not yell those Spain at the end of that.
Yeah.